I'm Dan Culhane from WCCO. We're with Dr. Joseph Hammang from Pfizer. He's the Senior Director Policy, or Science Policy?
Science Policy.
To be exact about that, for Pfizer Incorporated. And we're talking a little bit about healthcare collaboration and preserving collaboration in healthcare. And the healthcare industry is becoming increasingly focused on partnerships. And I'd like to know, could you tell us why that is so important to us?
Well, partnerships in the healthcare system have been important forever, to be very honest. The biopharmaceutical industry has relied on partnerships with academic medical centers, like great institutions like University of Minnesota and Mayo Clinic, to develop our medicines, and this has been going on for decades. So in that sense, the partnerships are not more important now, but they're certainly first and foremost in our minds for our ability to develop new medicines. That's our access to patients, and our ability to partner with academic institutions is critical for us to bring new medicines to the marketplace.
Is it hard to get people to understand that as far as consumers and the institutions themselves?
Well, there's oftentimes there's a willingness for the industry to fund clinical studies and to have access to doctors and to the patients. What we have trouble with other times is this perception in the general public, sometimes with elected officials, and frankly in the media, that this kind of interaction, this natural interaction for developing new products, that somehow taints the medical institution, it taints doctors and an academic institution. If we don't have that access, we're not able to bring new medicines to the marketplace and test those in the proper patient populations.
Now, you mentioned a couple of partnerships you have here in the state of Minnesota, the Mayo Clinic, the University of Minnesota. Can you tell us a little bit more about those?
Well, again, large medical institutions like it, those very powerful institutions that bring patients from a very large area, are critical for us to have access to patients for whatever studies we're doing in cardiovascular disease, in cancer, in neuroscience, treatments for neurodegenerative diseases. So that's why major institutions like that are critical for us, and certainly that's the case here in Minnesota.
And you talked about the collaboration, and some people criticize that collaboration with the drug industry, saying things like that they create conflicts of interest. Mm-hmm. What's Pfizer's perspective on that? Well,
first, there are two pieces to that. One of the areas where we feel that there's a huge benefit to society is some of the partnerships that we do with providers here in the state of Minnesota to do work on smoking cessation programs. We all know the ill effects that smoking brings to society. These are huge medical costs and huge human costs over time, and those sorts of partnerships are critical. We would like people to focus on those positive partnerships here in Minnesota and elsewhere. Your question about conflict of interest is a very, very important one. Again, if we are going to be developing medicines, it has to be done with major medical institutions and with doctors who practice in those institutions. By disclosing the relationships that we have, by disclosing the payments that we make for the work that is done at the medical center, to paying for the medical infrastructure, which is an obvious need for the institution, by having that disclosed, fully available on the websites to be able to see, and to have the co-disclosure, that is for the university to also share that information freely and openly, I think goes a long way towards understanding exactly what the nature of this important relationship is. That's what we want people to concentrate on as they're thinking about these important interactions.
So it's not a conflict of interest, but it's an appearance of a conflict of interest, and is it a question of education then?
I think it is a matter of education, but in all interactions, there are conflicts. Doctors have conflicts. Academic medical institutions have conflicts. The pharmaceutical industry has conflicts. We all have conflicts. If we understand that, if we recognize it, if we disclose it and we make it as transparent as possible for regulators and for the media, for elected officials, I'm confident that we can move forward in a positive way without concentrating too much on that kind of perception of a problem.
Well, as far as partnerships go, as we wrap things up here, is there one point that maybe I haven't brought up that you'd like to share?
Well, I think the most important point is that today medicines are developed in partnership with doctors and with major medical institutions. That's the way it's been for decades, and that's the way that is going to happen in the future. Limitations that we put on our access to doctors, that is the industry's access to doctors, and any restrictions on our access in hospitals, I think is going to has a positive negative impact on our ability to bring medicines to patients. That is the kind of impediment I think is what we are striving now to eliminate to the best of our ability.
Dr. Joseph Hammang is the Senior Director, Science Policy for Pfizer. I'm Dan Culhane from WCCO. Thank you very much for joining us.
Thank you.